Hello, good afternoon. So today I would like to show you a little bit the new way to perform a drainage of one of the common complications of acute pancreatitis. So this is a man. ¿Cuántos años tiene? With 58 years old that have history of acute pancreatitis recently, more a little bit a month. Yes, a little bit like 6 weeks. So now the patient's in spite of the treatment, the patient continues with pain and lose weight, and the situation that this patient at the CT scan have pseudocyst. So this is a patient with a complication of an acute pancreatitis, and it is very important to evaluate the situation of this patient, because this is important to solve the problem of this kind of complications. Okay, so the main indication is abdominal pain and with diminish of the appetite of this patient. Okay, so you can see here in the US, this is a big pseudocyst. So we will measure this this measure is 7 centimeters, almost 8 centimeters by 10 centimeters. So in this case, I will show you the technique of using Axios, Hot Axios in this case. So before to decide what kind of Axios we will use, we need to evaluate many things. One of these is to see if this patient have worrisome features during the evaluation at the abdominal ultrasound. In this case, I think that there is a necrotic area, that is this one. Okay, but when you compare with the whole pseudocyst, like the volume of the pseudocyst, it represents at least 20-25% of the pseudocyst. And one of the big advantage of the new technology using the luminal apposital metallic stents as Hot Axios is that this drainage could be performed alone. It means that it's not necessary with this quantity of necrosis. It's not necessary to use to perform necrotic drainage. It will be alone using a good diameter of lamps. It means that I will not use luminal apposital metallic stent of 8 millimeters of diameter or 10 millimeters when we have 10 and 20 millimeters of lamps, of diameter of lamps. So I don't know, tenemos de 20 milímetros. Sí. So I will use an Axios of with a diameter of 20 millimeters, because I think it's ideal. First, because the necrosis will go out alone, and second, because in case of if it is necessary, I can go inside even with a 15 millimeter, but I believe that 20 will be fine. So this is the Hot Axios. This is a 20 millimeters diameter inside the lumen. So it's very important that, because this will help us to avoid to go inside with the endoscope and to perform a necrosectomy in this case, okay? So I will show you the technique. It's very easy. It's 4 steps. It's a 4 steps luminal appositor stent. So this is the Axios. In the tip of the Axios, you can see we have a cautery. You can see here. Okay, I can put a little bit like that. I'm sorry. So we have an electrocautery in the tip of the probe, and we have the stents inside. So you can see here. We have I don't know if we can see with the camera here. So you can see here the four steps that have these lamps. This is the first step is going down. The second step, once the Axios is inside, is going inside with the electrocautery. Then we perform the second step, that is open the distal part of the Axios, and you can see here the directions of each step. Is very easy to use. Okay, so I am in a good position. It's very important also to see the best area to be drained. So in this case, I will measure the stomach wall, and this is perfect. This is less than 5 millimeters, so I am in a perfect position. Yes. So now I will show you. So we can start. It's 1440. Okay. I will show you how to deal with these cases in an easier and faster way. I am inside now. Okay. So now I will perform my second step. That is to open. You see my distal part. As you can see here. Okay. So now my third step is to retract a little bit the stand, and then to fix it, and to perform the delivery of the stand inside my working channel. I am working with a Pentax endoscopic ultrasound. You can see here now. Necesito ver la imagen endoscópica, por favor. You can see here my lamps at the endoscopic ultrasound. Here you can see the distal part inside, and here is inside the stomach. So now you can see the stent in the stomach. So I am sure that I am in a very good position. I see the stent. You can see here. The stent. the visual endoscopic evaluation. So it's draining. It's performing a good drainage, this pseudocyst. And at the endoscopic ultrasound, we can see also the stent and the drainage. Okay, this will solve the problem of the patient. I will use now a normal scope. It is very important to evaluate also if there is no any vessel in the gastric wall. That is the advantage, the main advantage to perform the pseudocyst drainage using endoscopic ultrasound technique, the endoscopic ultrasound technique. So now we will change the tube. I would like to show you the drainage. So this patient have biliary slush. Yes. So we will perform an upper ERCP after, because it's very important to clean the biliary tract. So now we are in the stomach now. You see the drainage is perfect. There is no blood. You can see the liquid. Coming from the pseudocyst of this patient. So a lot of aspiration, huh? ¿Cuánto llevamos? 600 ml. It's a lot. So you see, it's faster and easier to perform drainage nowadays. How many days I will last this Axios? At least 15 days. There are some papers published by some authors in United States showing the risks of bleeding in some cases. I really don't have the same experience. So you can see here, perfect. This will open until 20 millimeters, and in normal condition the necrosis will go out. So we need to evaluate the patient in the follow-up to see how is going the laboratory, and if the patient perform fever, and if the patient is going well, he can be discharged in 24 hours. So tomorrow this patient can be discharged, and this will diminish the cost of the hospitalization of this patient. Okay, so we are good. We are in the stomach, and now I think we will perform the ERCP now, just to clean the biliary tract. So thank you so much for your attention. This is my last video, I think. I believe it will depend of what kind of cases we will have in the next days before the end of the year. I would like to say happy holidays, and maybe if we don't see you in the next days, happy New Year. Okay, so I hope to have nice cases in the next days, and if we have at that moment, we will perform another transmission. But that for the moment, this will be the last transmission of this year. So thank you so much for your attention.